Good morning. I want to welcome you on behalf of the Keough School's Global Policy Initiative to our panel, Refugees Trapped in a Global Pandemic, an Assault on Human Dignity. My name is Clemens Sedmak, and I'm Professor of Social Ethics and Interim Director of the Nanovic Institute for European Studies at the Keough School of Global Affairs, University of Notre Dame. This is the background and some of the grim statistics that made us organize this panel. Every minute, 20 people leave everything behind to escape war, persecution, or terror. There are about 80 million forcibly displaced people worldwide at the end of 2019, according to official statistics provided by the UNHCR. In 2010, the number was 41 million, so it has doubled in the last 10 years. This means that 1% of the world's population is displaced. 68% come from just 5 countries, namely Syria, Venezuela, Afghanistan, South Sudan, and Myanmar. 85% of forcibly displaced people are hosted in so-called developing countries. This is a global drama. We recognize this global drama through World Refugee Day. World Refugee Day is an international day designated by the United Nations to honor refugees around the globe. It falls each year on June 20th, which will be tomorrow, and celebrates the strength and courage of people who have been forced to flee their home country to escape conflict or persecution. World Refugee Day was held globally for the first time on June 20th, 2001, commemorating the 50th anniversary of the 1951 Convention relating to the status of refugees. The Keough School of Global Affairs at the University of Notre Dame has made migration a priority issue. This is consistent with our mission of integral human development, and as a school that seeks to answer global challenges with evidence-based policy solutions. Today's discussion features research and expertise of faculty throughout the Keough School, along with the Migration Policy Institute, which is represented today by one of its esteemed visiting fellows. We will basically cover 2 themes. One, the current situation of refugees analyzed from a lens of integral human development, where we'll offer expertise from several regions of the globe through our panelists. And secondly, we will look into legal and policy implications. Today, we have 6 panelists. Each presenter will take about 7 minutes. As you know, this is the idea and the theory, and I hope that it will work out. We will go through all the presentations one after the other and then open up for a Q&A period. We have already received in advance 5 questions. I just want to let you know that this has been the case, so we may not be able to answer all the questions that may come up, but we will do our best, and my task here as the moderator is to function as the timekeeper and to moderate the discussion afterwards. I will introduce our panelists as they present, and I will start with the first one. And for this purpose, I will start sharing my screen. I hope this works. I will introduce our first speaker, which is Rahul Oka. Rahul is a research associate professor in the Keough School of Global Affairs here in Notre Dame. He's also a faculty fellow of the Kellogg Institute for International Studies. He's an economic anthropologist by training. Rahul has done research on the psychobiological and socioeconomic well-being of refugees and host communities, and he will present results from research on migrant and refugee issues in East Africa, South Asia, and Eastern Europe. Thank you, Rahul. The floor is yours.
Thank you, Clemens, and thank you for that generous introduction, and thank you to everyone who's attending this webinar and allowing us to share some of our research and some of our concerns about what has always been a global crisis, and now it's actually going to be much more grim, much dire. So as Clemens said, next slide. There's 80 million forcibly displaced peoples around the world, and those are just the ones that have been counted. And this is before COVID. And of these, millions actually live in protracted encampment for years and decades, and sort of within the spaces of society as non-state actors, as non-citizens. Now, in 2016, there was a change. There was the UN and more than 189 nations signed on to the New York Declaration that led to the Global Compact on Refugees and Migration, that we need to look at refugees and migration in a very, very different light, that it's not just about relief, but it's about relief and development. And it's about much more than just housing people for protracted amounts of time and trying to provide their basic needs. And this led to the Comprehensive Refugee Response Framework that I'm going to call CRRF. And it had 4 objectives. And the first 2 are feasible, but logistically very challenging, which is to ease pressure on host countries and to integrate refugees into host communities in building sustainable local social economies. I forgot to put the word social over there. Now, objectives 3 and 4 are most desired by refugees and also by donor nations and host nations, which is either to promote third country resettlement, that's highly desirable for refugees, or to promote safe, sustainable, dignified, and voluntary repatriation back to their home countries. These are politically improbable and not very feasible. So basically, in order to get to 1 and 2, objectives 1 and 2, we need to understand the daily lived lives of refugees and hosts. What are the conditions that are affecting them as we try to go to objectives 1 and 2? Next slide. So this is just a snapshot of some of the complexities that face any CRF implementation or any relief organization that is operating large refugee camps that have hundreds and thousands of people. So on the top, you can actually see the things that we all see, the things that are really easy to see. But as you look under the water, I've given here the Iceberg Model to essentially show how there's so many different factors that essentially combine to create these, what I would call disabling environments. And so any attempt to provide anything to refugees beyond just your basic physiological needs actually have to account for all of these particular issues. And this is just a snapshot. And this basically deals with our work that we did in East Africa, in Kenya specifically, but you can make a similar map for any protracted refugee situation anywhere in the world, and you'll come up with a very similar Iceberg model. And to make lasting change, we can't just go to the top. We have to actually follow it through down to the bottom to see that these are addressed or at least understood, if not responded to. So next slide. So even though we've done research in Eastern Europe and South Asia, here I'm actually going to focus on some of the findings that we've had as we worked with bodies such as the World Bank, UNHCR, and various other civic bodies in Kenya. And so on the top, on the northwest corner of Kenya, as you can see, you actually see Kakuma refugee camp and Kalobei settlement. And then you see the Dadaab camp near the Somali border, near the right side. And then down near Nairobi, you see the urban refugees. And we've conducted research in all 3 places. Now, when we did the World Bank project, next slide, we focused on various things, which is our team consists of cultural anthropologists such as myself, biological anthropologists, computer scientists, and development experts. And we've collected data on physical health, psychosocial, economic, and cultural well-being, basically mixed methods research, but our primary focus is through ethnography to understand these complexities. And really what we're trying to understand is the political economy. So we've all heard NIMBY, right? Not in my backyard. And definitely when we, this is the result from 2015, when we looked at how many people are reporting negative impacts of refugees. This is a host community. So the camp is in Kakuma, which is to the left-hand side of your screen, and each of those other bars are counterfactuals that essentially represent distance away from the camp. And as you can see, the negative impacts, they, more than 20% or more than 1/5 of the population reports negative impacts of refugees. But it was the next slide that is dramatically different. The closer you are to the camp, the more the positive impacts of refugees. And these are the host communities that are reporting them. The further you go from the camp, the lower the positive responses, which essentially means that this is a very deeply human thing. When you get to know somebody, even if you're thrown together and you interact with them because the situation demands it, yes, you can have negative interactions, but you can also have positive interactions. And this was one of the biggest insights that actually came out of our World Bank and UNHCR study that we conducted the social impact assessment of, that essentially showed that the refugee presence actually had a positive social, health, and economic benefits for the local host community. Next slide. And we've done multiple projects with UNHCR and with other bodies, including USAID and the State Department. And these are some of our findings, that it's social networks and social support systems that are the primary predictor of success and failure in establishing businesses, in mitigating psychosocial and physical health, and that normalcy and dignity are key factors in predicting coping ability. And how do you actually get this normalcy and dignity? To be able to sometimes buy good food. So if you're celebrating Christmas, to be able to buy a cake rather than eat relief beans. To be able to celebrate the birth of a child with a feast. To be able to conduct daily activities that include something like washing dishes, so preparing your children for school. And these things that make us human, they also give people resilience, and refugees have tremendous resilience. We also found that friendship and faith networks have the most positive impact on resilience and self-sufficiency. Now, this cannot be new to us. And especially in this pandemic, we've realized just how much we need other people. Next slide. And this is what refugees have been living with. So the pandemic has lessons for humanity. The plight of refugees has become even more dire. Food rations have been cut, services are reduced. And this is not just now, this has been happening for some time. Various development processes are shut down, traumas have been exacerbated, and relief missions have been pressured from all sides to do more with less money and with fewer personnel. Their plight is also dire. And of course, when you look at local employment, that's down. Remittances globally are down. Refugees depend on remittances, but the economies here are not doing well. So people here, their diaspora and relatives can't send money back. The commercial economies of the camps have been hit. More than 50 million displaced urban workers now have added to the 80 million displaced peoples. So the UN's comprehensive refugee response framework provides some hope, but is it enough? And I would actually say, yes, because we did encounter some good things, and that might be just anecdotal, but in 2019, we conducted a formal study on the barriers facing refugee and host self-sufficiency and enhancing resilience. This was for USAID, for the US government. This included desk review and field research on CRF implementation and gaps, and it focused on Kakuma and Dadaab refugee camps, which together have about 400,000 people in some of the most inhospitable terrains on the planet. And the reason I say this is hope, because it was the US government that recognized the importance of CRF implementation and asked for help to understand the barriers to self-sufficiency and resilience in what they knew were disabling environments. This was not just a, let's wave a wand and throw some money at the problem and it will solve itself. They knew that there's a lot of work ahead, and they wanted the data. They admitted that they needed a different approach, and they invested in it. A commitment to the CRF process. And I saw this same commitment through all the stakeholders that we interviewed and we spoke to. There was a general agreement that protracted relief and encampment are not just sustainable, they are not just not sustainable, and they do not provide lives of dignity, which is part of practically every UN document out there and every donor document out there. The relief world is said to be guided by Maslow's hierarchy, which prioritizes physiological and security needs over psychological and self-realization needs. My colleagues are going to address this in more detail later on, but in our study, Most stakeholders we spoke to were in agreement that dignity as a part of psychological and self-actualization needs is an essential and basic need, as it's not a luxury to be considered down the line. And there was also the agreement that repatriation and resettlement are not politically unfeasible. So how can we help to build homes and allow people to live in dignity, to live resilient lives and dream of better things for their children, to live lives that are not just marking time and waiting in line to go anywhere else, or to just disappear from global memory. We can try and provide support for building such lives to make sure that psychological, spiritual, social, and your basic food, shelter, and clothing are all accounted for in any intervention. And this is one of the pillars of CRRF and this holistic approach. And as citizens of donor and host nations, we cannot look away now. Now that we understand even a billionth of the trauma of displacement and life under restrictions like encampment, this pandemic has ripped apart the facades of global economic well-being and has revealed us all vulnerable to displacement. It's going to be even harder now for the refugees. If they're low priority for donors and host nations before the pandemic, they might almost disappear from public imagination as rampant unemployment of citizens and national economic collapse are politically more crucial priorities. Yet we call on all citizens of all countries to be empathetic. There's a lesson here. We were under lockdown for 3 months and we found it unbearable. Think of decades of lockdowns like this. Refugees will survive and their hosts as well because they're humans and humans are resilient. But that can't be a fallback. More than 100 million people now are displaced and most likely permanently because of COVID. This includes the people who were displaced before. If we turn our backs now because their plight is not important enough, then there are no other lessons worth drawing from this pandemic because we failed the basic test of humanity. So this is from our findings that people are trying to live, they have always tried to live lives of dignity. And this new step that was taken in 2016 and the commitment of stakeholders, that's even more crucial now and we can't look away. Thank you very much.
Thank you very much, Rahul. Thank you for this reminder of dignity is a basic need, and there is literature on dignity needs. Thank you for the reminder that it takes ordinary life and normalcy to have a dignified life, a sense of predictability and what to expect and safety, which is our integral human development perspective that we adopt here at the Keough School. Thank you, Rahul.
Thank you.
Our next speaker is Aaron Corcoran. Aaron is the Executive Director of the Keough Institute for International Peace Studies and concurrent Associate Professional Specialist in the Keough School of Global Affairs. Aaron's work has focused on immigration and refugee law, human rights law, and other complex legal topics at the national and local level as a trained lawyer. Aaron will focus her remarks on the treatment of asylum seekers at the US-Mexico border. Aaron, thank you so much. The floor is yours.
Thank you, Clement, so much for that. So yes, today I'm going to spend some time talking about the US response to asylum seekers and refugees currently, and actually how, unfortunately, much of the treatment has departed from the very principles and commitments that states have given in 2016. And I also just wanted to preface my remarks by saying that historically in the United States, immigration and refugee protection has not been a politically partisan issue. In fact, most administrations have agreed that refugees deserve protection and that the US should serve as a role model to the international community in humanitarian aspects. That being said, our current president, Donald Trump's use of his executive branch authority to wage war on immigrants has been one of his defining legacies of his presidencies. During his presidencies, he's issued executive orders that have included severely limiting entry of non-citizens to the US, travel bans of nationals from 18 different countries, the suspension of the US refugee resettlement program, facilitating the mass deportations of individuals residing in the US, and even targeting naturalized US citizens and individuals with valid visas. So today, as we commemorate World Refugee Day, I want to discuss how he has also used this authority to currently dismantle our US asylum system and roll back significant legal protections for refugees seeking safe haven in the United States. The US asylum system was designed to ensure that the US government meets its legal treaty obligations of the 1950 Convention relating to the status of refugee and the subsequent 1967 protocol to which the US is a signatory. Central to the 51 Convention and the US Refugee Act of 1980 is the obligation of a nation state to not return individuals who are fleeing harm. And President Trump and his administration have taken significant actions that undermine these very obligations and have sent asylum seekers back to harm and even death. In particular, the Department of Justice has gutted legal protections for vulnerable individuals, such as women fleeing gender-based violence and victims of human trafficking. The Department of Homeland Security has implemented inhumane measures in an attempt to deter individuals from seeking such protections. Such practices have included separating families in detention, including infants and toddlers, increasing the use of detention for asylum seekers, attempting to roll back protection for unaccompanied children, and forcing asylum seekers to wait in Mexico in dangerous conditions while their asylum claim is being decided. Could you show the first slide, please? Recently, Trump again went on the offensive using the COVID-19 pandemic as a political shield to ban asylum at the US-Mexico border. Citing public health concerns, Customs and Border Protection began expelling migrants, including unaccompanied children, back to Mexico without determining whether these individuals were fleeing persecution and eligible to apply for asylum in the US. Since March 20th, when the Center for Disease Control order went into effect, over 20,000 individuals have summarily been expelled. Even in times of emergency, summarily sending individuals back to torture and possible death breaches US and international law. In addition, the Department of Justice is actively promoting changing US law to deny asylum and other humanitarian protections to any individual, quote, infected with a communicable disease of public health significance, end quote. This political move not only violates US and international law, but it is morally reprehensible and a violation of human dignity. And to that end, international experts have endorsed 14 principles of protection for migrants, refugees, and other displaced persons during the COVID-19 pandemic in order to guide policymakers, public health workers, individuals living in communities of forcibly displaced people, and advocates on how to adequately and best respond to the pandemic. The document's key principles are equal treatment and non-discrimination, the right to health, states' obligations to combat stigma and xenophobia, and restrictions of movement between states, as well as ending detention or encampment practices. Please, second slide. Even before COVID-19, in January 2019, the Trump administration instituted the Migrant Protection Protocols, which forced over 60,000 asylum seekers to remain in Mexico during their immigration proceedings, which placed them in extreme danger. Only 5% of these individuals had access to lawyers during their asylum process. And of those 60,000, there were about 16,000 children, 500 who were under the age of 1, and also several pregnant women. Asylum seekers are currently staying in makeshift tents with no protection from the Mexican government. The conditions in these camps are deplorable. They lack clean water sufficient to follow the World Health Organization's basic hygiene recommendations. And these unsanitary conditions have left asylum seekers, including small children, vulnerable to the spread of illnesses. And with the onset of COVID-19, such living conditions place these asylum seekers at even greater risk. The UN Special Rapporteur for the Right to Adequate Housing, Leilani Ferrara, expressed her concern about these informal settlement and emergency shelters. She said, quote, "Housing has become the frontline defense against the coronavirus. Home has rarely been more of a life or death situation," end quote. In addition to the health concerns, there are basic physical security risks for these asylum seekers as they wait in Mexico. According to Human Rights First, there has been 1,114 publicly reported cases of murder, rape, torture, and kidnapping of these asylum seekers as they await in Mexico. A study by the US Policy Center at the University of California at San Diego found that the longer individuals waited in Mexico for their court case, the more likely they were to suffer physical violence. These deplorable conditions have raised legal questions about whether this policy has sufficient safeguards in place to ensure the lives and freedom of asylum seekers are not threatened. In addition, such conditions also prevent these refugees from having any normalcy or lives of dignity, as Rahul noted just earlier, is essential for all of us, including refugees. And then finally, I want to speak to a policy that was just pronounced on June 11th by the current administration, and which it issued a notice saying that it's going to amend US asylum regulations to create additional hurdles and barriers for asylum seekers. This proposed rule that was issued would ban asylum for any individual who has spent more than 14 days in another country en route to the US without applying for asylum there, to anyone who's transited through a third country at all, to anyone who has been in the US without authorization, without exception, and to any person who fails to file taxes or who has worked in the United States without authorization. It also significantly narrows who qualifies for as a refugee and eliminates asylum for any claims based on gender, persecution, or gang violence. It also defines persecution as only severe and repeated physical harm and doesn't allow mental anguish or less forms than torture to constitute persecution. This rule is open for comment until July 15th, and then it will become a final rule. This rule will most likely be challenged in the courts, but until there is a decision about the legality of this rule, thousands of asylum seekers will not be able to avail themselves of protection in the United States. Our country's responsibility to protect refugees fleeing persecution and death due to their religion, political opinion, race, nationality, and membership in a particular social group is not only a legal one, it is a moral one as well. These individuals did not choose to leave their homes and their homelands. Rather, due to severe and persistent violence, refugees are forced to leave their livelihoods, and in hopes that the international community will take care of them and treat them with dignity. Unfortunately, current US policy falls drastically short of our legal and moral obligations, and it is my hope that we can write this policy through legislation to protect the rights of asylum seekers at the border by ensuring that they are treated humanely and allowed to live with dignity. Thank you.
Thank you, Erin. Thank you for the reminder that refugees are asylum seekers, and the asylum system was set up to meet the legal requirements. It used to be a non-partisan issue. Thank you for reminding us of the connection between vulnerability and human dignity. I tend to think that we would not have the discourse on human dignity had we not the experience of vulnerability. And in COVID-19 times, the challenge of housing and the right to housing and health has become a very important aspect to be considered. Thank you, Erin. Our next speaker is Diego Chavez. Diego works with the Migration Policy Institute. He's an international public policy expert advising the United Nations, the World Bank Group, the Organization of American States, and USAID implementing agencies. Diego will report on the status of Venezuelan refugees. Thank you for joining us, Diego. The floor is yours.
Thank you, Clemens. Thank you for having me here. It's great to be here today talking about migration, an essential topic in the international development. I look forward to sharing important information on Venezuela and the very sad and problematic migration crisis that the overall region has been facing. Just a bit about me. I am a DC public policy expert, tackling forced displacement on migration and advising and assisting Latin American governments on public policies concerning migration and refugees, an area that is becoming even more interesting and problematic at the same time during COVID-19 crisis. I also consult for the World Bank on similar issues, and previously I was based in Bogota working for the UN Migration Agency, where I started looking into the issue of migration in 2015 when President Maduro expelled 40,000 Colombians in Venezuela overnight. And I was deployed by the United Nations to help register thousands of people at the border and provide them with shelter, food, and supplies. 2015 has also been a true turning point for migration in the region, as that was when people have also started coming into Latin American countries while traditionally they had been only fleeing their native lands to other parts of the world. Venezuelans have started migrating to other Latin American countries in large numbers as soon as political tensions spiked and their country's economy collapsed. As of March 2020, at least 5 million Venezuelans were living outside their country, 4 million of them in other Latin American countries. The majority migrated between 2018 and 2019. Colombia now hosts the most significant number of Venezuelan refugees and migrants, with more than 1.8 million. But other large concentrations of Venezuelans are in Peru, 1 million, and another million divided between Ecuador and Chile. This movement of Venezuelan constitutes one of the most massive forced migration flows anywhere in the world, not far behind that of Syrian refugees. Most countries in Latin America have generally tried to accommodate these recent arrivals. They have provided them with education, healthcare, and labor assistance. But given the scale and the speed of the Venezuelan migration, international cooperation is essential to helping national governments respond the right way to these challenges and mitigate the crisis. For the purpose of this presentation, I want to focus on 4 major areas of concern for migrants that I have researched on: education, health, labor, and human mobility, specifically focusing on return migration. Regarding education, all countries in Latin America provide universal access to education, regardless of their immigration status. However, because of a complicated registration process and schools becoming overcrowded, migrant families are struggling to enroll their children, forcing them to ultimately spend months or years out of school. Venezuelan migrants struggle to provide host countries with documents showing proof of a child's education background and previous school transcripts, which means that it is almost impossible to tell what a grade a child should be in or how he previously performed in school in order to better integrate them into the new system. While most countries in Latin America have been affected by Venezuelan migration, Colombia has by far the most Venezuelan students in its schools. The good thing, if we can say that, is that Venezuelan migrants in Colombia are spread more evenly than in other receiving countries. In countries like Peru, for instance, 85% of the Venezuelan migrant population is concentrated in the capital city of Lima. This means that the city's already overcrowded schools must rapidly adapt to accommodate this influx of new students. In terms of health, issues that Venezuelan refugees and migrants have in terms of access to healthcare in receiving countries are particularly urgent, especially because the healthcare system in their home country is not functioning properly. UN Migration Services surveys from 2019 indicate that in receiving countries that have available data, between 5 and 15% of Venezuelan interviewed were suffering from chronic illness or infection disease, such as TBC, diphtheria, or measles. In theory, receiving countries have healthcare systems accessible to anyone who needs it or who needs medical care, but universal access is not always a reality on the ground. These healthcare systems often lack resources and are overwhelmed, which means their ability to care for patients is very limited. In some cases, national policy is also disconnected from the local policy, where healthcare providers may not fully understand these systems are meant to be universally accessible. But despite the limitations of universal healthcare systems, whether due to capacity or implementation issues, they do offer refugees and migrants some opportunities to access medical care than other systems. In terms of labor, the majority of Venezuelan adults suitable for paid work in countries across the region were already working before COVID-19. In fact, more than 90% of Venezuelan migrants in Peru and 8 in 10 Venezuelan migrants in Colombia were employed before the pandemic. The problem is the type of employment that these migrants and refugees get. Data shows that 7 in 10 Venezuelan migrants in receiving countries are usually informally employed because it is difficult for them to provide the official documents needed to be legally integrated into the local labor market. Most refugees and migrants with either temporary or permanent residency can obtain documents that authorize them to be formally employed. However, even if they can obtain work authorizations, employers may not trust or understand how to handle this documentation. This is particularly problematic for those in Colombia and Peru, where legal status for migrants and refugees from Venezuela has only recently been established. For instance, only 4% of regularized Venezuelans in Colombia had a job in the formal sector, even though the vast majority of these migrants were between the ages of 18 and 70. Similarly, although 500,000 Venezuelans have been issued with legal status in Peru, only 45,000 Venezuelans are formally employed. Many Venezuelan refugees and migrants have skills and educations that could be assets for receiving countries. In many such countries, the overall Venezuelan migration population is actually better educated than the native-born population. For instance, in Peru, 31% of the working age Peruvians have advanced degrees. By comparison, 40% of Venezuelans in the country have advanced degrees. In addition, a quarter of Venezuelan migrants in Colombia have advanced degrees and 3/4 in Argentina. Finally, regarding return migration and COVID-19, I want to say that Venezuelans who settle in Latin American countries during the recent migration waves are also losing their economic streams because of COVID-19. As they are unable to work or access help, at the moment, data shows that a small percentage of Venezuelans are returning home from exile. If the lockdown continues and no aid is provided, many more could follow along. But the Venezuela's healthcare system is so weak that the most basic and most important requirements, such as hand washing, are impossible to meet, even by healthcare providers. Venezuelan doctors and nurses indicate that soap and disinfectants are virtually non-existent. As inflation has soared and purchasing power has dropped, it has become impossible to bring needed supplies. Public hospitals in Caracas are also suffering from frequent water shortages. In hospitals in remote areas such shortages can last even months. Under such circumstances, sick people are most likely to avoid hospitals in Venezuela altogether and instead cross the border and try to access health care somewhere else. Currently, 60% of Venezuelan migration in Latin American countries is irregular, as it is difficult for Venezuelans to legally obtain passports. Because of this heavy bureaucracy, people choose to simply cross dirt roads between countries and bypass border controls. Most likely to do so are forced displaced migrants suffering from hunger, who also lack opportunities at home. And these issues should be immediately taken seriously by policymakers, especially in the age of COVID-19, as they come with severe humanitarian and public health implications. If vulnerable migrants lacking access to basic hygiene, healthcare, and money keep moving from one Latin American country to another, this will in turn impact local populations. Policymakers should urge discussions on epidemiological surveillance for Venezuelan migrants and overall take crucial measures to better protecting their rights and integrating these migrants into their host communities. These are only some of the issues that we have been helping governments tackle. So happy to take any questions on this, and thank you for your time.
Thank you so much, Diego. This was an important reminder of integral human development means looking at all the dimensions of human life: education, health, labor, mobility. We also learned that basic human aspects like hand washing says so much about human rights and human dignity. And we are grateful for the data that you have provided. So far, we have been in Kenya, at the Mexican-US border, and in Venezuela or Colombia. And now we are moving with our next two speakers to Europe. Our next two speakers are Paul Perrin and Ilaria Schneider von Wartensee. They share a panel slot, but they will address slightly different issues. I will introduce them at the same time nonetheless. Paul Perrin is the Director of Monitoring and Evaluation at the Pulte Institute for Global Development and also an Associate Professor of the Practice in the Keough School of Global Affairs. Paul has served as Director for Monitoring, Evaluation, Accountability and Learning at Catholic Relief Services. He will present on the issue of responding to the needs of refugees. After Paul, we will hear Ilaria Schneider von Wartensee. Aren't you glad that you have the name here on the screen? Ilaria Schneider von Wartensee is the Ford Family Research Assistant Professor at the Keough Institute for International Studies. Since 2017, she has been working on the humanitarian corridor in Italy. And Ilaria, a trained economist and anthropologist, will offer insights into the current situation of refugees within this program. We'll start with Paul talking about responses to the needs of refugees. Thank you, Paul, for being with us. The floor is yours.
Thank you. And can you please move to the next slide? So two words that have really gained traction in the world today in our current situation that have entered my own vocabulary as well as yours. One would be shelter in place, and the other is social distancing. And the reality is we are all experiencing to a certain extent what it feels like to be a refugee, although their situation is order of magnitude more complicated. They are not sheltering in place, they are rather sheltering out of place. And this contributes to a deep social distancing that is not of their choosing. They are socially distanced from their loved ones often, their relatives, their communities, their culture, their language, and further socially distanced in their new location by the fact of who they are and their status of refugees. And so as we seek to to really connect with their experience. We now have concepts that are part of our own experience that can help us to understand their plight. When it comes to responding to the needs of refugees as a result of their situation, one of the seminal documents in the refugee and humanitarian space is the Sphere Humanitarian Charter and its accompanying materials, including the Sphere standards. The initiative was initially launched in 1997 in response to the much needed requirement for increased professionalism in the wake of several failed high-profile responses to refugee and other humanitarian crises in the 1990s. The materials themselves are heavily focused on ensuring minimum standards are met for individuals receiving humanitarian assistance, including refugees. Now, this has had the welcome effect of creating a common language for those working to coordinate responses. It has helped to improve coordination and really help set response priorities across many organizations who are working to meet the needs of refugees. Next slide, please. However, one might say that this approach has implicitly moved many in the humanitarian sector to see the world in a way that is consistent with something akin to Maslow's hierarchy of needs, with the entry point being at the bottom of the pyramid. While subsequent revisions of Sphere have expanded the idea of basic needs to include elements in the middle of the period, as well as those in the bottom of the period, and has also sought to add a dignity lens to revisions, including the most recent one, the majority of the practical materials really tend to focus on the first two levels and meeting the needs there. The problem with this way of viewing the world in crisis is that the entry point itself at the bottom of the pyramid doesn't seem to work well for the overall well-being of refugees. How do we know this? Well, we know because when we are willing to listen through research, through evaluation, and through conversation, they frequently tell us this, regardless of where in the world they may be located and where in the world they may be coming from. Now, I want to be clear that in saying this, I'm not criticizing the important work of Sphere, because they have really served a critical purpose. But what I'm trying to do is encourage us to broaden our minds, because we learn from listening that this Maslowian way of thinking facilitates a view of displaced humanity as something like humans in waiting, who first need to be fed and given things, with the understanding that the affected populations will then be able to take this step towards self-actualization as humans. Next slide, please. Now, it's unsurprising that refugees tell us that they don't like being treated like anything less than human. Our own research and the research of many others, such as the Humanitarian Policy Group cited here, in different humanitarian settings are filled with sentiments such as the ones offered here by forcibly displaced people and their representatives. Now, I suspect we could probably get 80 million quotes about this from all of the refugees around the world today. Next slide, please. We learn from listening to refugees that the hierarchical way of thinking facilitates a view of humanity that ignores the two-way exchanges between these needs, much less that there are a number of social, structural, and socioeconomic challenges to self-actualization. And indeed, we haven't even figured out how to do this with non-displaced populations. We don't even need to look much farther than within the borders of our own country and the movements for social justice that are happening today that refer to some of the structural inequities and systemic challenges that really hinder the ability for humans to move and fulfill their basic needs. One of the questions that we're posing today is what would change if we saw refugees not implicitly as creatures that need to be fed and protected and sheltered, but deliberately first and foremost as human beings with dreams, desires, and socio-emotional needs that complement their physical ones. In other words, what if instead of on the left, we started from the bottom, moving up, we allowed our entry point to be the top of the pyramid that allows us to see all of the needs holistically from the beginning. This doesn't diminish the need to meet basic needs, as they are perfectly visible from the top looking down, but it may change how we interact with refugees and respond to refugee crisis. This is an important question to grapple with because the magnitude of the challenge is immense. As we've already noted, there are just shy of 80 million forcibly displaced people in the world. Turning our lens toward Europe, the influx of refugees in the mid to late 2010s was dubbed the European migrant crisis. And refugees poured into Europe from Africa and the Middle East, most notably from Syria and Afghanistan. At the height of the crisis in 2015 and 2016, when more than 1.3 million refugees poured into the continent, European politics, societies, and economies were strained in the effort to cope with the influx. In this type of a situation, it is valid to ask the question, how can we treat refugees more holistically when the situation is so rapid and urgent and the needs so clearly overstrain our ability to cope? So I would like to turn the floor to my colleague Ilaria to describe work on one project that is seeking to look at refugees through this type of an inverted lens. Importantly, this project also captures the voices of the refugees themselves so that we can learn from their experiences as we seek to create a better world. Ilaria, over to you.
Thank you, Paul. Ilaria, the floor is yours.
Thank you, Paul. Thank you, Clemens. The first slide, please. Since decades, thousands of migrants have risked their lives crossing the Mediterranean to reach Europe. The most recent data reports that about 25,000 people have tried to reach Europe this year, the majority by sea. Over 347 people died in the Mediterranean this year. You can switch to the next slide. Just 7 days ago, a boat heading for Italy sank on the Tunisian shores. At least 54 people died. Pope Francis, in this year's message on the World Day of Migrants and Refugees, said, I quote, "You have to know in order to understand. When we talk about migrants and displaced persons, all too often we stop at statistics. And I can go on with these statistics. But it's not about statistics," continued the Pope, "it is about real people. If we encounter them, we will get to know more about them. And knowing their stories, we will be able to understand them. We will be able to understand, for example, that the precautionedness that we have to come to experience as a result of this pandemic is a constant in the lives of displaced people," end quote. In 2017, I went to Lampedusa, Italy, this tiny island close to Tunisia. I met Mullah, a teenager from Somalia, just crossed the Mediterranean Sea. He was alive. In 1 week, he was able to reach Germany illegally. 2 years later, he was expelled from Germany and sent back to Italy because of the Dublin regulation, which establishes which member state is responsible for the examination of asylum application. In the case of Mullah, was Italy.
Ilaria, you want to see the next slide?
Yes, please. He had to, this is Mullah on the right. He had to start all over again. Now, after 4 years, I texted him yesterday, he finally got his legal documents. However, he still lives in a refugee shelter in Rome, which he called it camp, even if it's in Rome. He's not financially independent and not much integrated. In response to this situation, the next slide, in 2017, the Italian Catholic Church, through Caritas and other organizations, started the Humanitarian Corridor Project, which allows refugees to enter legally and safely to Italy, to Europe. The Humanitarian Corridor Project is a system of community-based sponsorship that offers a personalized method of accompaniment with a host community for a minimum term of 1 year, a more dignified way to ensure refugees' integration. In 2018, with Professor Clemens Sedmak, I started a longitudinal evaluation of the project, and we created a web documentary called Human Lines to show what we are discovering. We did more than 400 interviews in more than 45 communities so far. And we discovered that integration is complex. Language barriers, difficulties to find jobs, even more now with the pandemic. Refugees suffer trauma, family loss, they lack their communities and what they left behind. It is hard for social workers to manage expectations of volunteers and refugees. The hard work is with the local communities. This is not just a matter of helping refugees, but to work with host communities, involve citizens. When this happens, that changes the territories, the relationship, the people. I give you just one example of this happening. You can watch these other stories in our website. Omar is an Eritrean teenager boy. Is the one you can see in this slide on the bottom. He arrived in Italy in 2018, February. I actually arrived with him on the same flight from Ethiopia. They started to live in a small town in the northern side of Italy, a town hostile to immigrants. He lives with his family, is the only one providing the salary, even if he would like to study. Fabio is the owner of a pastry shop in that town. He was not an official volunteer when he met Omar outside his shop, and he offered him right away a possibility for a job in his pastry shop as a waiter. Fabio defended him against racist offenses by the guest of his pastry shop. They started an unexpected friendship, but things went complicated because Omar wanted another internship. So he stopped to work in the pastry shop. Fabio got angry. He even called me last year saying, I am so disappointed. I feel lost. And he had to trust Omar that this was his way to integrate in the Italian society. And that is a challenge for everybody because you start to serve and you feel disappointed because it's not the way you thought maybe. As Pope Francis said in this same message, I quote, "It is necessary to be close in order to serve. Fears and prejudices keep us distant from others. Drawing close to others often means being willing to take risks, as so many doctors and nurses have taught us in recent months. This readiness to draw near and to serve goes beyond a mere sense of duty." End of quote. Our societies are willing, those are my questions, are our society willing to take the risk as Fabio took? How Fabio's move can be sustained? What is at stake? What does it mean to accompany these journeys, not just the one of refugees, but also to volunteers that fear or they don't know how to accompany? I told you real stories with real people. Because of the large numbers of refugees, humanitarian corridor cannot be the only solution to the problems arising from human migration, but is a dignified way, an opportunity for refugees and communities for mutual growth. Thank you.
Thank you so much, Ilaria. Thank you, Paul. We have been reminded of human dignity is not a luxury that comes in once basic needs are met. It is a basic need. And it's not the case that human beings are animals that have one stage after the other to be met, but it happens all at once. So the richness of human life happens because we are agents with hopes and dreams and emotions. And it would mean a paradigm shift on so many levels if we were to see migrants and refugees first and foremost as agents with dignity. And Ilaria has also made clear that accompaniment and encounter are key pillars to make it possible for us to see the human person as a human person. And I think that's one of the threads that runs through this panel so far. Wouldn't it be a revolution of the perception and the mind if we realized refugees are human beings, are members of the human family, and human dignity is part of any person wherever he may be in. Our very last panelist is Dennis McDonnell. Dennis is professor of the practice of public policy at the Keough School of Global Affairs at the University of Notre Dame. From February 2013 until January 2017, Dennis served as White House Chief of Staff for President Barack Obama. Dennis will offer remarks on refugee and migration policy, and I can stop sharing my screen at this point. Dennis, thank you so much. The floor is yours.
Clemens, thank you very much. It's great to be here with everybody. I think you just see in this panel why I am so honored and excited to be associated with the Keough School, a school focused on integral human development, built on experts like those you've just heard from, and experts who inform their work by data, by experience, and by hard-nosed scholarship. And the observation you just made, Clemens, about the fact that a thread that runs through these presentations being focused on the dignity of each person made in the image of God, I would argue is the thread that runs through the Keough School, and a recognition that in public affairs and in policy making, the best policymakers are able to see through the policy to the people affected by those policies. So it's not just a question of a stale debate or competing sociological understandings or social science understandings. It's in fact an exercise in ensuring opportunities for each individual to have the dignity that he and she are right to demand, in as much as they're made in the image of God. So it's particularly, I think, meaningful in the context of tomorrow's celebration of World Refugee Day, where we honor the refugees around the world and celebrate their strength, their courage, their determination in rebuilding their lives away from the conflict and persecution that forced them, as Ilaria said and as Aaron said, forced them from their homes. And obviously, as we try to stem the rise of this coronavirus in the United States, we give thanks in particular to the thousands of refugees who are serving on the front lines here and overseas around the world to fight this pandemic in their new home countries. As we've heard from several speakers, the challenge is massive and growing. The UNHCR report released yesterday points out that the number of people forcibly displaced continues to rise, nearly 80 million people last year, which is 1% of the world's population. And as more people become displaced, fewer are able to return home given the increase in protracted conflicts around the world. One that's particularly a particular focus of mine and has been for some time is the conflict in Syria, which is now entering its 10th year of civil war. And of course, climate change and natural disaster resulting therefrom will only exacerbate this challenge going forward. Next year will be the 70th anniversary of the Convention on Refugees and the 60th anniversary of the Convention on the Reduction of Statelessness. The Convention on Refugees helped to define refugees and the legal protections, assistance, and social rights to which they're entitled, as well as their own obligations to their host countries. They're remarkably forward-leaning documents as you consider the breadth of rights assigned to people in the state of refuge. And the question for us now is the distance between, as Paul's and Rahul's comments made, the distance between the conveyance of those rights and dignity, or the conveyance of those rights and the actual realization of those rights and the dignity that comes therewith. The number of forcibly displaced has doubled in the past decade. And so the question is, or the challenge for us is, these legal requirements and legal rights have only become more important. But the fundamental question, I think, for the policymaker, in light of everything we've just heard in these hotspots of migration, Europe, Mexico, Kenya, South America, particularly with Venezuelans, are the rights and the instruments that convey those rights as envisioned around European displacement after World War II still relevant in addressing this current age of mass displacement. So just keep in mind the following figures. The World Bank projects 140 million people in 3 regions, Latin America, Sub-Saharan Africa, and South Asia, will be forced to migrate by 2050. 140 million people. Sexual violence and gang extortion in Central America are also forcing migration to the US and even Europe, yet there's no international standard on how to deal with such victims. 40% of the forcibly displaced are children. So 30 to 35 million of the forcibly displaced are children. And 85% of refugees in the last year were hosted in developing countries, countries whose economies are in constant state of crisis, and it's obviously only going to be made more significant in light of the pandemic. So the question is, for policymakers, do the documents themselves, the conventions themselves, need to be re-envisioned in relation to this massive challenge coming forward and the massive challenge we're living today? Or is it a question of execution of access to the existing rights and enshrined in the convention? And so is it merely a question not of trying to reopen an international agreement, but merely an exercise in the kind of individual actions that Rahul and Ilaria, Diego, Paul, and Aaron have laid out? And so at the Keough School, our goal is to make sure that we're training public affairs experts, policymakers, field experts to address that question going forward. And I leave you with this concluding bit of hope in an otherwise very difficult set of challenges, in addition to all the good work that was just been laid out. In January of this year, governors from 42 states and community leaders from more than 100 cities and community and county governments affirmatively provided written consent to acknowledge their willingness to welcome and resettle refugees in their communities. This was in direct response to a new executive order, Aaron made reference to it, from the Trump administration that gave local communities the right to say to the federal government, we refuse to accept refugees. The overwhelming response before that executive order was enjoined by federal court, but the overwhelming response from Republican and Democratic community leaders, state governors, and mayors was to say that we welcome refugees, which of course is consistent with a long bipartisan tradition in the United States, going back to time immemorial here. So the question for policymakers is, do we need new international instruments, or do we just need to exercise with greater urgency the rights afforded refugees under the existing instruments? That's a debatable question. We welcome the questions on that here, and I'm sure all the panelists will have different views of it. But it's against a backdrop that I'd say, at least in the United States, that there is still a broad recognition of the United States needing to play a significant role in this ongoing challenge. So Clemens, back to you, and I'll look forward to the questions. And I thank all my fellow panelists again for the opportunity to be with them.
Thank you so much, Dennis. Thank you especially for ending with some hope. There is a book by Peter Beering who talks about human dignity as a form of life on the level of perception. And if our policymakers had this form of life and this perception patterns, many things may change. I also took away this danger of gaps. There's a gap between what we experience and the evidence, the gap between the evidence and the policy decision, and then the gap between the policy decision and the implementation. And your question about, do the legal frameworks that we have at our disposal, are they sufficient to meet the needs that we have right now? So as you see now, all our panelists turned on their camera. We have 25 minutes for questions. And this is the most challenging part of this event because questions are coming in. So I will ask all my panelists to be very brief and precise. And you could still be brilliant and funny, you know, in your responses. I will take 3 questions together. 2 that were sent in previously and 1 that came in today. And these questions relate to the awareness of people. Refugees seem like a distant problem for most Americans. How do we make the problem more relevant? And what do we want them to do? That's 1 question. Second question, very similar from a Notre Dame student. Would there be any way that we as students could help refugees from our respective homes? And the third question that came in today, how do regular citizens fight to promote the safety of refugees in the United States, especially under an administration that is largely intolerant to refugees? So these are 3 questions related. What can be done from a citizen's perspective, from a student's perspective? And I welcome panelists' brief responses to these questions. Whoever wants to go first. Yes, Erin, please.
Well, thank you for those questions. I think they're really important. And I think there's a lot that individuals can do because as Dennis made reference, most of the decisions now to resettle refugees in the United States lie within local communities and local policymakers. And oftentimes the needs of these refugees that have been resettled are immense. And so there's lots of opportunities to connect with your local faith-based organization or nonprofit organizations that are responsible for resettlement. There's a need for volunteers.
Thank you, Erin. Any other taker for this question? The question, what can be done from a citizen's or student's perspective?
Well, I mean, you know, there's a problem of there's of course a problem of how do you actually deal with people who've been resettled here, but also the people who are far away, because the policy seems to be we need to keep them there so then we don't have to deal with them here, right? I mean, that's why most of the people who are hosting refugees are developing nations who have lots of problems of their own. And one way is that as citizens of the biggest donor nation, right? As a people of the United States, we are already funding many programs, and I think that if citizens actually start to take an interest in these programs, actually work with your congressman, work with various groups that are championing the cause of refugees to actually understand more about their lives. Remember, when I showed that graph that the further the distance from refugees and hosts, the fewer the positive perceptions. But if anything, the social distancing essentially shown is that we need to have physical proximity in order to have a better understanding of the humanity of the lives. And I think that's the key part. Understanding the humanity of the lives and increasing one's interaction with the people who are already in the field, who are already getting their hands dirty, so to say, who already in a vanguard. I don't know whether throwing any more money at this problem is going to work, but if citizens can get involved in demanding more accountability, and also when money is spent, is essentially spent in making sure that the refugees' needs of dignity are taken into account.
Thank you, Rahul. Ilaria, can I ask you for a very brief statement what students could do to help refugees?
I would say it starts from knowing the classmates that maybe are refugees themselves, or DACA students at Notre Dame, for example. How many of your friends are DACA students? I would start from your neighbor to help, or to at least listen to them and try to understand them. That would be the first way to understand what it's all about.
Thank you, Ilaria. And your website, Human Lines, shows the faces and stories, which makes it a little easier. I would like to ask
Clemens, can I add something?
Can I add? Oh, okay.
Very briefly.
I would just want to say there's a great passage in the book, Screwtape Letters, that talks where the devils are trying to teach each other how to be good devils. And one of the foremost ways to do it is to have people fall in love with the idea of humanity that's distant. So you love people that are distant and try to do that while hating people that are in your circle, close to you. So I think it can start with identifying opportunities to accompany refugees in your own communities.
Thank you, Paul.
Can I finish?
For the non-Christians, this was a book by C.S. Lewis, Screwtape Letters, a Christian apologist who died in 1963. I have two questions for Dennis, please, that just came in. Dennis is surely right about the need to find ways to implement the values and rights in the Refugee Convention. Is the challenge lack of commitment to the values in the convention by citizens at large, or are there political and institutional issues that need to be addressed? That's the first question, Dennis. And since you're brilliant, I can throw a second to you as well. The United States has not ratified the first optional protocol of the International Covenant on Civil and Political Rights. Citizens cannot appeal to UN review committees. Should we start from urging governments to honor the promises that they made when they signed these documents? Sir Dennis, please.
Excellent. I saw, though, that Diego was trying to say something, Clemens, so I just want to make sure that I give him the mic before I answer.
Okay,
So
Diego, sorry, I didn't see you. Yes, Diego.
No, it's fine. I was just going to say that it's important for societies to try to reivindicate some narratives that are happening at local communities as well. So for instance, in my country, we organized I'm from Colombia, by the way. We organized a challenge who would make the best arepa, or Venezuelans or Colombians, or at schools, for instance, they played the national anthems of both schools at the beginning of the journey as well, of the school journey. So I think this type of narratives that are important to reivindicate, and I think the media also has a lot to say about this, and I'll try to reivindicate this type of narratives. That's very short.
Thank you, Diego. And sorry that I didn't see you. I have to, the Q&A and the pictures and all these people. I'm a 20th century person.
But he buried the lead. So who makes the best arepas?
Oh, definitely Venezuelans.
Dennis, do you still remember the two questions?
I think I do.
Yes, please.
There aren't. I don't think there are structural or even political impediments to the exercise of the rights inherent in the convention. And I guess the case study, I think, to be perfectly honest, it's a question of will. And so I'd point to two data points to support that argument. One is the United Nations General Assembly Summit on Refugees in September 2016, where all the member states came together on the sideline of the UN General Assembly to commit themselves to specific actions to fulfill some of the rights inherent in the convention or listed in the convention, including right to employment and right to education, for example. And out of that came a series of very concrete commitments, including commitments from the United States to increase resettlement slots in the United States. And so that was just a manifest. Nothing had to change there except the political leadership of those countries to say, this is important to us. Here's our commitment. We'll make that commitment going forward. Now, those commitments are in various states of execution at the moment. And this is why I think leadership from the United States is particularly important because, for example, as the United States has reduced its commitment to resettling refugees, as Aaron briefed, other countries have said, well, wait a minute, if the US isn't going to do its part, then this is difficult for us to do. We're not going to do our part. So it's one, a question of will. Two is these are winnable debates. I mentioned this question earlier this year of governors and county executives and mayors affirmatively granting their assent to refugees being resettled in their areas. The forerunner of that was a big debate we had in 2014 and 2015 after a nightclub shooting and terrorist attack in Paris that led to a series of governors in the United States saying we won't take refugees. The argument being that somehow ISIS and affiliated terrorist groups were going to use access to various resettlement programs to sneak into countries and then carry out these dastardly acts. We engaged the debate and we won the debate. No governor was able to maintain his opposition to resettlement in his state because we publicly engaged the debate and we won the debate.
Thank you, Dennis. One concluding sentence, sorry to be rude.
No problem. On the second thing, yes, I think the government should be held to account for living up to the rights that they've agreed to. And the way to do that is exactly what Ilaria and others just said, which is, and Paul in particular, which is citizens need to demand of their governments that they live up to the commitments they've made.
Thank you, Dennis. I will have to be a little stricter now, so I will call on people. We have a question that Rahul wants to take. Is there a way we can make African refugee host countries take it as a responsibility to support refugees with dignity? A case of a minister of Uganda who just said, I quote, if UN doesn't fund, we are taking back refugees to their home countries. Such a blatant statement undermines the dignity of refugees. Rahul, please.
Thank you, and thank you for that question. And the thing is that this is a very complex question you've asked about a really, really complex topic, because Uganda is currently hosting about 2 million refugees, right? And Uganda has had one of the most open systems for refugees. For example, refugees can live anywhere they want. They have the right to work. They have the right to subsistence. And right to live wherever they want. The problem is that when refugees come, most of the people who are poor are going to stay in camps and remain reliant on relief. And all the, oh, you can go whenever you want and do whatever you want is not going to help them. These are now problems of poverty that are lying on top of displacement trauma and so on and so forth. And from the viewpoint of the African host nations, now I'm not essentially saying they're right, they're essentially saying we're dealing with millions of refugees and we have problems. Famines that hit the northern regions of Kenya actually hit not just the refugee camps, but they actually hit all the host communities that are actually living over there. And the host communities, very often, like the Turkana host community, is much worse off than the refugees of Kakuma. Right? So basically the African, yes, the leader who said, we're taking refugees back to their home countries, there are other politicians who said the only good refugee is a dead refugee. Those are there and they're there in every country in the world. But then there's also all the people in the Refugee Affairs Secretariat that have all the complexities of a particular bureaucracy, that very dedicated people who are doing this as a career and so on and so forth. But we have to step back and essentially say that all of these African host nations have signed on to the CRRF. They have tried to make changes in the legal system. Some have actually done so. Ethiopia has made recent changes, Uganda and Rwanda, of course, but Kenya is also trying to make changes. The problem is really so complex, and of course political expediency comes in, which means that I need to get votes. And refugees are a great political platform on saying they're taking our jobs, they're taking our land, and so on and so forth, and we're going to advocate against them.
Thank you, Rahul. A concluding sentence?
Okay, and so my concluding sentence is that it does undermine the dignity of refugees, but on the other hand, the concerns of the host nations have to be taken into account, and we can't just say, just deal with them because you're host nations. We have to increase the funding, and we have to do it in a way that will actually give self-sufficiency, self-reliance, resilience, and dignity to the refugees and the host communities.
Thank you, Rahul. I would like to ask a question to Paul, a question that was sent in yesterday, and then I will ask the question to Erin that she asked to take. Paul, the question is, how much reliance is there on faith-based organizations to support refugees?
Well, I think there is, in many ways, a resonance with faith-based organization with the concept of human dignity. One of the things I did in my dissertation was look at this concept of dignity across the mission statements of many organizations, humanitarian and refugee sponsoring organizations. And a lot of the organizations that had it front and center as part of their mission statements, their vision statements, their value statements were faith-based organizations. And so for them, this is an entry point that I think resonates with the notions of their faith. I've worked with a number of different faith-based organizations within and also supporting doing evaluation work. I think there's a fine line to be had in order to maximize the utility of faith-based organizations. There needs to be some, in addition to this value and this mission, there needs to be professionalism and really learning from what the data are telling you, in addition to really respecting and living this mission. And so finding ways to really to define success in practical ways, to measure success, and it doesn't have to be with just the number of mouths that we've fed, but really, what does it mean to have dignity? How can we listen to people's stories and know that we're doing this? But I think they serve a valuable purpose in really recentering a lot of the efforts around the human dignity of the person and using that as a starting point. And I think we can learn from those organizations.
Thanks a lot, Paul. If I may just add, David Hollenbach authored a book last year called Humanity in Crisis, where he specifically looks at the contribution of faith-based organizations to addressing the plight of refugees. And we had a Keough School panel with him just a few weeks ago. May I ask Erin to answer Victoria's question? The question is, how would reopening the United States-Canadian border help to relieve and give support to refugees? Is Canada doing enough for them?
Thank you. Just very briefly, the inability for refugees to flow back and forth between Canada and the United States is actually more regulated by a memorandum of understanding between the US government and Canada, similar to the agreements in Europe about wanting people to seek asylum in the first country in which they come into. One of the reasons that Canada really pushed for this in 2001 was because oftentimes asylum seekers would actually come through the US and would not seek asylum in the US and go straight to Canada, in part because the conditions for them while they were seeking asylum were much more generous and treated them with much more dignity. For example, there's no detention of asylum seekers in Canada. You get an attorney to help you go through the process. You also get living assistance and housing while you're applying for asylum in Canada. So the cost for each refugee that or person applying for asylum in Canada is a lot greater. And so actually, I feel like in some ways, if the US actually was treating asylum seekers with more humanely, there wouldn't even be the need for this kind of agreement to happen, and people would be going to Canada to reunite with their families. And so I do think Canada's doing a good job. I don't think that's the problem. And then one just quick thing I wanted to circle back to the question about what folks can do, ordinary citizens. I did post in the Q&A a link to the Federal Register if you're interested in submitting comments as individuals, as students, as community members, opposing the regulations that the Trump administration just issued regarding restrictions on asylum seekers. You have until July 15th to do so, and the link for that is in the Q&A as an answer to that question.
Thank you, Erin. We have two questions that I would like Diego to answer, please, in our last 5 minutes. Don't take 5 minutes, take 1 minute. And it's about COVID-19. How does COVID-19 affect refugees' access to food and their overall situation?
Thank you. Well, most of the migrants, as I mentioned in my presentation, are working in the informal sector, and many of them have lost their financial lifeline. Some of them have decided to go back to Venezuela. This creates a lot of problems for governments, hosting communities, and also for the migration, for the flow of migration itself, because when they go to Venezuela, they are exposed, because the way that they go to Venezuela, they're going to be walking, or they're going to take buses, they're going to go into shelters, and they're going to be exposed to the disease. Venezuela is not conducting any sort of real test. Most of the tests that they perform are not very accurate. And thus, we don't have a lot of information of what's happening in Venezuela. Also, we share a border, Colombia and Venezuela, they share a border that is roughly the same distance from Athens to Berlin. So most of the, and there are only 7 official crossing points. So most likely migrants are going to start when the pandemic hits, when the curve steepens in Venezuela, most of the migrants are going to start migrating to Colombia to seek for medical care. And they most likely will do it through what we call trochas, which are the dirt roads specifically. And this is going to be very problematic for epidemiological surveillance. Yeah.
Thank you, Diego. That was helpful. Dennis, there is a question about the 1951 convention in the post-World War world and our present situation. And the question is, how different are the situations? And is there a lot we can learn from the way refugees were responded to in the 1950s?
Yeah, well, I think the principal lesson we can learn is to recognize that to flip the argument on its head a little bit that we've just been discussing, which is I think the real challenge for us as policymakers right now is to see through these massive numbers to the individual needs and the individual dignity of each refugee. That's a challenge, and I think Diego, Rahul, Paul, Ilaria have laid out precisely how we can do that. But I think the big takeaway from 1951 is to flip that then and say there's strategic importance to overall stability and effectiveness of the international system in addressing this big problem in its overall manifestation. And so I think that's the challenge we need to underscore to public policymakers and to political leaders today, which is to say that we face a set of strategic challenges about stability in the international system and about what we intend to be as democracies in the 21st century that will only be answered if we handle this massive crisis related to the dislocation of people and handle it well.
Thank you.
If we continue to think it's somebody else's problem, as Rahul said, it's often argued, then we won't get our hands around it, and the strategic implications for us will be massive.
Thanks a lot. I have 2 more minutes and our plane is landing soon. There's a challenge for Rahul. Can you answer in 1 sentence the question, what would be the solution to the protected refugee camps that you have seen in Kenya and elsewhere?
That is a wonderful question. And in 1 sentence, I can essentially say that we spent the entire last year pondering this question. It gave me nightmares at times, but we presented a report to USAID that was officially presented on the 28th of February. The report is live, and I'm happy to share it. What we did was that we took USAID's charge of saying, we know the situation is disabling. Tell us what we can do within this to enhance self-sufficiency resilience. And so we have a few recommendations of that have come out of it that could be locally feasible, culturally appropriate, and move towards self-sufficiency. Thank you.
Thank you, Rahul. I'm impressed. So I apologize to all people who asked questions whom we could not accommodate. I apologize to the panelists whom I had to cut short. We reached the hour, and I believe in ending on time to honor people's schedules. Thank you so much to all our panelists. Thank you so much to our IT people in the background, Maura Policelli, who set this all up and coordinated that. Don't forget, tomorrow is Refugee Day, and this is the beginning of the rest of our lives, and the work is just about to begin.